Thank you, Presiding Officer. My daughter Rosa was born on the 1st of April 2017 at University Hospital Wishaw. She was born at 27 weeks gestation, weighing 535 grams, or just £1 3 ounce. She came home from hospital almost exactly 5 months later, with the vast majority of those 5 months spent in the neonatal intensive care unit the Scottish Government planned to downgrade. My daughter's birth was an emergency one. My wife's labour was induced early because she had developed an acute infection which, if left unchecked, would have killed them both. We were told that because of our daughter's size and gestation, she'd be very likely to be stillborn or die shortly after birth, but that the neonatal team would be on standby to do what they could. We were left hoping and praying for a miracle, but miracles don't happen, miraculous people happen. After birth, the miraculous staff at Wishaw worked to keep our daughter alive and get her into the intensive care unit for the start of a 5-month rollercoaster journey of recovery. There couldn't have been a stabilisation and then transfer to Glasgow, Edinburgh, Aberdeen, or maybe even the north of England because she was too sick. What the Government are proposing will mean Lanarkshire parents of the sickest babies, the ones who need the most support, will be left with a choice of making a journey they know isn't in the best interests of their baby, or leaving them with a skeleton staff who don't have the award-winning knowledge, experience or capacity which exists right now. Shortly after my daughter was born, my wife's health deteriorated. She was haemorrhaging and had to be rushed to emergency surgery. She spent over a week in recovery. She felt incredibly guilty that she couldn't be beside her baby's cot with her daughter, but at least she could be nearby a close-by ward to provide the breast milk, which is so crucial for the survival of premature babies. Now, I know it would have been far too much for her to cope with, for our baby to be moved to a different hospital before she herself was healthy enough to be discharged. But there was also the issue that this wasn't our first child, this was our second child. Sick babies aren't born in isolation. It's all very well for the Government to say that travel, accommodation, food costs are covered, which is a good thing, but parents had to fight for it, and it's absolutely galling that that has been used as a shield, a partial shield, for this decision. But you're talking about moving mothers away from their communities, away from their families, away from their children, away from that vital support network. How does a mum get their kids to nursery or school in Lanarkshire and then get to Aberdeen to care for their sick baby? Now, I've told my family's story, but it's far from unique. There are Rosas being born in Wishaw every other week. I've met them. Their families haven't been listened to. The staff haven't been listened to. Presiding Officer, this Parliament, this Government should be listening to the team in Wishaw working miracles every single day. We should be supporting the staff to do the award-winning work that they want to do and supporting families to give the baby their best start locally, surrounded and helped by their wider family and community. Thank you, Presiding Officer.
Thank you, Mr Griffin.